you guys getting the message that it's recording? Okay, thanks. Hello, everyone, and welcome to St. Barnabas Family Caregiver Support Program Education and Training presentation for this week. My name is Michelle McGuire. I'm a case manager in the Family Caregiver Support Program. This presentation is being recorded and will be placed on our YouTube channel. So if you would like to remain anonymous, please do not speak out. And this week's presentation is on CPR, DNR, and 911. So to get started, we're talking about CPR and DNR. It usually applies to advanced illness. And advanced illness or a serious illness usually involves late stage chronic illnesses like cancer or diabetes, MS, Alzheimer's, anything can be late stage. But it's basically when one or more conditions become serious enough that your general health and functioning decline, treatment begins to lose impact, and pretty much you're going to be progressing to the end of life is going to be your next stage. That's what we refer to as advanced illness. So when someone is in advanced illness, it's highly likely that they may receive CPR if, people do not have forms or instructions in place. And here I digress. When you call 911 in the United States, their job is to provide out-of-hospital acute medical care and transport. And basically, they're going to get your heartbeat and breathing going, and they're going to transport you to the hospital. And they are legally bound to perform CPR unless there is another legal form that tells them not to perform CPR. So again, when you call 911, the paramedics come. If somebody is passed out unconscious, they are going to perform CPR. So what is CPR? Cardiopulmonary resuscitation. It's to treat cardiac arrest. The heart and the lungs are made to work artificially. It can be done manually through chest compressions by hand, or electronic with a defibrillator, or with drugs injected straight into the heart muscle. And for the lungs, the resuscitation, the air is forced into the lungs either through mouth-to-mouth resuscitation or through a bag valve mask or intubation. And for CPR, the purpose is not necessarily to start the heart, but to restore partial blood flow to the brain to prevent tissue damage or brain damage. Yeah. And cardiopulmonary resuscitation, the survival rates are not that great. In a hospital, survival rates are only 26%, and out in the community, it's 16%. And when we say community, that includes the paramedics. So that's pretty low. Only 16% of people survive cardiopulmonary resuscitation. So DNR stands for do not resuscitate. And in the field, there's something that's called a pre-hospital do not resuscitate form. This is relevant when you call 911. Pre-hospital do not resuscitate form. Basically, it tells the paramedics do not perform CPR. So they will not, if you have one of these pre-hospital DNR forms, the paramedics will not do chest compressions. They'll not assist breathing. They won't place a trach or anything like that, and they won't intubate you. I mean, they won't give you drugs. So they might do all kinds of other things, but they're just not going to do these specific things. This just prevents them from doing CPR, and it only prevents them to doing it on the way to the hospital. It doesn't stop life-sustaining measures such as artificial nutrition or hydration. You could be intubated for food to be put in. It doesn't stop treatment for pain, difficulty breathing, or major bleeding. Okay. It only stops CPR, and it's only until you get to the hospital. So that's a pre-hospital DNR form. The POST form, physician orders for life-sustaining treatment, the POST. In California, this specifies the end-of-life treatments that someone does or doesn't want. It's a doctor's order that stays with you and stays in your chart, and it legally prevents emergency medical responders from performing CPR. So the POLST, unlike the pre-hospital DNR, the POLST form applies while you're in the hospital, before you get to the hospital. It applies 100% of the time. You just need to keep it with you. And the POLST form, you can state whether you do or don't want CPR, but you can also state what type of life-prolonging medical interventions you do want on top of comfort care, if any. So you get to specifically say, and you also get to say under what circumstances you'd want to be moved to a hospital, if you'd want feeding tubes, and if so, for how long. So you get to give specific details about what you want, and it's a doctor's order. That means it's legally, people are legally bound to follow it. Now, the difference between a pre-hospital DNR and a POLST, I've already talked about it a lot, I think. Pre-hospital DNR, physician's order not to perform CPR, only applies to CPR, only applies before you get to the hospital. A POLST applies to all treatment interventions and care, effective at all times in and out of the hospital. Now, there's something called an inpatient DNR. Inpatient, do not resuscitate. And you'll see DNR written on some people's medical charts in big letters on the outside, so that everybody knows. And what this is a doctor's order not to resuscitate if the heart or breathing fail. And they must also have a patient consent to write this in the chart. The patient must consent to DNR. And this only legally applies while you're in the hospital or in the clinic, so it may not prevent CPR by the EMS staff. This will only happen when you're in the hospital. So some issues with inpatient DNR. What is resuscitation? There's a lot of language in the medical literature that is using resuscitation, the term resuscitation, to talk about IV fluid. Like if somebody was burned, they're saying resuscitation is giving them IV fluid. Or when they've had hip surgery, they're being resuscitated after surgery, or they're being resuscitated after allergic reaction. So this makes it very complex when we say do not resuscitate, because exactly what is resuscitate talking about, right? Also, they found that when patients have DNRs in the hospital, some clinicians don't give those people as much care. There's kind of an assumption that patient doesn't want treatment, that treatment won't help, that they just want comfort care, kind of like, hospice, but that's not the case at all. So there's been some research, and they've actually found that patients who had hospital DNRs actually got fewer of all these listed here: blood transfusion, cardiac catheters, cardiac bypass, surgery, blood cultures, etc. Those are just some examples. Another issue is automatic DNR. A physician writing a order for DNR in a patient's chart without the patient's consent. And this does happen sometimes. It's often, most of the time, it's added to the patient's chart after CPR. If the patient codes in the hospital and they get CPR, an order is automatically, DNR is automatically written into the chart. Okay. One other form I'd like to talk about is an advance directive. An advance directive is used to guide physician decisions if a patient is incapacitated. It's completed by the patient in advance. It talks about what type of treatments, medical interventions you'd want in different situations, and it names others who can make medical decisions for you. Advance directives are good, but the POLST seems to be the most stringent and the most detailed. For example, an advance directive would not stop the paramedics from performing CPR on you. A POLST would. And the last form I'd like to talk about is a power of attorney. And this is, I don't know if it's a form, it's more of a phrase, power of attorney. It's a legal document allowing others to act on your behalf in terms of private affairs, your business, or legal matters. Okay, so again, I think that the POLST form is probably your best bet if you're taking care of somebody who has serious or advanced illness, because it specifies the end of life treatments that someone does or doesn't want. It's a doctor's order that you keep with you, and it can legally prevent emergency medical responders from performing CPR. And that is it. I'm going to stop sharing my screen and open it up for discussion. Anybody have any questions or comments?
This is Leda. Hi, Michelle.
Hi, Leda.
I was just gonna say that since I've gone through this with my dad, that all of what you mentioned was, I mean, I don't think I did not have a need for any of those. I had need for all of, pretty much all those documents, and the sooner you get them done with your loved one, the better. Especially like with my dad, when he was declining, we right away did that before he even started cancer treatment, because they did inform me that he might, it might affect his memory, and it might affect his decline. So I was just gonna say that in the case of my mom, who has Alzheimer's and still with us, I did request a letter from the doctor as well, saying that what her condition was, because in case that she's having sundowning or anything like that, they can understand, and they can also treat her, you know, accordingly, not if need be, without thinking that she's being violent or reacting out of impulse, but rather because of her illness.
That's really smart. That's really smart, Carrie, to have that letter with you. And so can you tell me about like when each of the forms was important? Like when is the advance directive important?
That's anytime they go into the hospital, they would require a copy of it. My dad most of the time would go to the same hospital, St. Vincent's, until it closed. So after a while, they would look it up and see that they had a copy, but most of the time they would require it there. They would require it at when he was sent to the nursing home. Hospice required it. So any of the medical, at least with my experience, it's any of the medical facilities or treatments, they would require it for sure.
They actually required it. That's really good. Now, did you have to fill out a post form, or do you have a post form?
You know, I don't recall that one at all.
Wow.
I don't know why. Yeah, but I don't. Not that I may not have done it. I just don't recall. Yeah.
Yeah. I think it's less popular. I think the advanced directives are more popular, but in my opinion, the posts are a little more stronger legally and can be just as detailed in it as an advanced directive. Except I think the advanced directive it allows you to name other people, and I don't know if the post does that, actually.
That's true, because I think I put my oldest son on the advanced healthcare directive in case I wasn't available, because he's usually my go-to person if I'm not here, it's usually him. So yeah, that's true. And you know, if it's a form that it's a legal form that way, then for sure I did not fill that out. And that's definitely new to me. Yeah.
Yeah, the post form. You might want to, check it out for your mom.
I will.
And,
thank you.
And that needs to be signed by a doctor. You fill it out with the doctor.
Okay, I'll tell her primary to see about that. Thank you very much. That was, I don't think that for sure. I never heard of. I thought maybe it was something they gave you at the hospital, but no. Okay, yeah, for sure I didn't.
Yeah. Louise, are you there? I can see you're on, but I don't know if you're available. I'm wondering if you have a post form for Clay.
Yeah, I'm here. Sorry, it's so quiet here, and I can't start with my video. It's not working right now. I'm on my
No
laptop.
problem. No problem.
It's so noisy. That's why I mute it.
Okay.
Okay,
Do you have a post form for Clay or an advanced directive?
He always wants to have the full, you know, full treatment. He has no DNR.
Got it.
And I'm just wondering if there's any side effects, just in case he will have a full treatment and then he revive. And is there any side effects on his health afterwards? Just in case.
Well,
I just wondering.
CPR does impact the patient's body. I mean, I've heard people say, and I don't know if it's true, but I've heard people say that it's real hard to do manual chest compressions without breaking somebody's ribs. And you know, the drugs, when they put them in, it's a pretty big, long needle that they go straight through the chest wall cavity and they stab it right in there. And I think CPR is kind of a violent procedure on the body. Yeah.
Okay.
Especially
So
for
go ahead.
older adults who are more fragile.
Right.
I think it'll cause more damage on their body as opposed to somebody who's healthier and younger.
Yeah, right. Because Clay is 78 and he has 2 DBS implant into his chest, left and right. Yeah, that's controls his shaking because he has Parkinson
Yeah.
for more than 25 years. And so I was just wondering because he's what do you call that, last will on his health. He wants the full treatment.
He wants them to do everything possible to
Everything
save him.
possible. But when he was in the hospital at the ER, that's the very first thing they asked me. Just in case something happened, what do you want us to do for him? Things like that. So I always say because that's what he wants. But I said, how long do you do that usually? They said 40 to 50 minutes. But I said, maybe you can just do 20, 30. So it will not be, if your response is good, but if he didn't, then stop at the 30 minutes or 25 minutes. It hurts
Yeah.
to watch that.
Yeah. It's
So I was just
understandable.
wondering about the side effect, just in case he revived afterwards.
Yeah, you might want to Google it and read up on it a little bit
Yeah.
because they
I'll
do a lot of intensive
Mhm.
procedures to the body.
Okay. Thanks.
And I don't know. Yeah.
And I think also it's always good to, as time and your caregiving duties, change, it's always good to go back and review the forms and say, do you still want this? If the individual's still capable of course, deciding on their own and being, mentally stable. It's always good to go back and check, okay, this is what you want. Do you still want it? Just to make sure nothing has changed. Because people have changed their minds and said, one day they do want everything done, extraordinary measures. Next thing you know, it's like, nope, I don't want CPR or I don't want such measures. So it's always good to go back because I know advanced healthcare directives, you can change and modify it. The pulse, can you do that with the pulse?
You probably have to go back to the doctor and, do a whole visit and all that, I would think.
Okay.
I'm just guessing that, but.
Well, with regards with Clay, he has these documents already for his health last will. So just in case we talked about it and he said, yeah, you have, he agreed with me because for me, I don't like full treatment. If it's if we see that he cannot really do it, then might as well have the DNR.
Yeah.
With regards to legal matters, especially the children, the family, do you think that will get against me or something afterwards?
Oh, no. Like
Because,
as if somebody could come and charge you?
yes, because in his paper documents, it says full treatment.
No, because this is where your advanced directive would come in, where he can say, I don't want full treatment. I just want a little bit of CPR. If it's CPR doesn't work after 5 minutes, stop. He can say that there.
No,
and he
he can.
signs that.
this is the problem. Clay cannot speak.
Oh, but he writes it down, and you know it's
Can't.
written.
He can't. It has been done 2 years ago with his lawyer. So right now, because of the situation and his situation right now, so I don't know how can I change that document just in case on the last minute he will tell me, right, you maybe I should have the DNR, and then
Yeah, if
something
it,
happened to him, and then on the legal matters, which the family knows, especially the children, his father wants a full treatment.
Mhm.
Can they come to me afterwards? Something happened to Clay, and legally he wants full, but at the very end, I gave them a DNR.
you wouldn't be able to give them a DNR without the proper consent. You know what I mean? They're not going to move forward with it unless it's legal. They're not going to let you, because they would be breaking the law. You know what I mean? They're not going to change Clay to DNR without following the proper procedures. If you have authority to do that, then yeah, you're okay with that. And you won't, if you have authority, then you cannot be held accountable because you were given authority to make that decision. You guys chime in if you know anything on this.
Yeah, it's the problem is at the paperwork and documents, legal papers. He says full treatment. And on the last minute, we talked about it. We just discussed it, and then something happened to him, and then I give the hospital a DNR.
Well, go ahead, Olga.
If you have power of attorney for his health, then you're able to make decisions once he's not able to. That's where you come in. But that's only if you have power of attorney over his health.
Yeah, even if he has already on the papers said it there, I can still change that in the
Yeah.
last minute. Oh,
Yeah.
okay.
Yeah, because you are his designated individual
Okay.
to make decisions once he's not able to make them for himself.
And the advance directive is, like doctors are not bound to go by an advance directive. It's just, it lets the doctor know what the patient wants, but the doctor can override it.
Mhm.
Clay could say, I want everything available in his advance directive, and the doctor could say, no, we're not going to do that. It's a waste of time.
Right.
So that's an advance directive though.
Right. If the doctor decides.
But you
But
have the power of attorney, healthcare.
yes,
If you have healthcare power of attorney, yeah, then
Yeah.
what Olga said is correct, and you are not going to be liable at all, legally liable.
yeah, because it happens last time, last June, that I was asked, and I said yes, he will have DNR because we talked about it. But afterwards, like a couple of hours, when the son came and he came to know about it, and he talked to the doctors before he talked to me to change it, because he
Hmm.
knows that ever since his dad wants to have the full.
Right. That's
So,
interesting. You might want to set up a virtual appointment with a lawyer and maybe update the advance directive to include the possibility of maybe changing it, to DNR, and that's up to you.
okay. At that time, we end up like I change it because the son demand.
Yeah.
Okay, got it. Thank you.
Mm-hmm. Yeah, it's kind of confusing. It's not clear which forms do what. So I just wanted to kind of go over a little bit of it, introduce it. So thank you all for your input and your participation. It's really helpful. So I'm going to go ahead and stop recording. Thank you.